A medical breakthrough is happening with chemotherapy for patients battling aggressive small cell lung cancer and to have very few options for treatments. The FDA has approved a therapy that protects healthy cells and is reducing side effects of chemo. Dr. Keith Lerro of the Wilson Regional Medical Center is here with the details. Thank you for joining us, doctor. And what do you see as an oncologist happening with your patients due to the heavy side effects of chemo?
Well, I've had patients who had very treatable malignancies who perhaps had a friend or a relative who had a bad experience with chemotherapy. And even though I know in my heart that they can benefit from the treatment, and I might feel strongly that the benefit outweighs the risk, there are many people who simply refuse to take the treatment. Furthermore, there's other patients who will start the treatment, but due to side effects, they'll choose to stop it early, or the doses will need to be reduced, sometimes to the point where the treatment's not as effective. So what this means for me is it increases the pool of people who are willing to take chemotherapy and who are eligible to take chemotherapy, because the side effects of the highly effective treatments are much less than in the old days, before we had this class of drugs, which are known as chemoprotectants. They protected the good cells and thus reduced side effects.
Is this going to be available to more cancer patients, and how can people get more information about this breakthrough?
You can get more information at the Lung Cancer Foundation of America website. That's at lcfamerica.org. Currently, this class of drugs is only approved in small cell lung cancer. Research is currently being done in other malignancies, so we're hopeful, depending on the results of the current studies, that these drugs will be available in other common cancers such as colon cancer and breast cancer in the near future.
Thank you, doctor. We wish you the best.
Thank you.
Go to businessfirstam.com for where to see our show on TV.